What's going on, everyone? It's Alex here from Aleks Physio, and today we're going to be chatting a little bit about sports hernias. Sports hernias, we've heard it in sports before, but what is it actually? So it's defined as lower abdominal or groin pain without the presence of a true hernia. So what is a true hernia? It's when there's a protrusion in one of your abdominal or some of your abdominal contents. There's an inguinal canal, which is basically an area that connects from the middle of your pelvis to your ASIS, which is the bony part on the outside of your pelvis. And there's an inguinal canal, and when you have a true hernia, then what can happen is that your abdominal contents of your intestines can actually protrude through this weakening in our abdominal wall and can cause a hernia. So that's different, and that you would notice a lump or a bump when you do things that generate more intra-abdominal pressure, like coughing or sneezing or bearing down. You can actually palpate a lump. That's an inguinal hernia. There are other types of hernias as well, but basically the premise of a true hernia is that you have abdominal contents that protrude through weakenings or protrude through different parts of your abdominal wall. So what's a sports hernia? A sports hernia is you can have tearing of your abdominal muscles, primarily your rectus abdominis, or weakening of that muscle, or weakening or tearing of the adductor longus muscle, which is one of your main growing muscles. Or how does this happen? It's most commonly as a result of sprinting, cutting, changing direction, pivoting, and it's usually on one side. And the reason why it happens is both your rectus abdominis attaches onto your pubic symphysis, which is a bony part on the front of your pelvis. But the other significance of that is so does that adductor longus muscle. When you contract your abdominal muscles, it pulls your pelvis backwards and up. And when you contract your groin muscles, the force of that pull pulls it down and out based on the forces. So you have different forces that are acting on the pubic symphysis, which is that attachment for those two muscles. And it's thought that when there are differences in terms of strength or which muscles are working more or used during different movements, that difference in the two can cause pulling that's more dominant. If, let's say, your adductor longus muscle is stronger or your rectus abdominis, and that difference in the pulling on the front of your pelvis where they attach can cause that tear or that injury in your abdominal muscles or even in your groin muscles, because you can have both of them at the same time or one or the other. It's more commonly thought to happen in males because we have a more narrow pelvis relative to females, so that can cause more differences in forces and can affect the overall stability of our pelvis. There are 5 signs and symptoms that are generally recognized as encompassing most individuals who have a sports hernia. So this entails a subjective complaint of deep growing or abdominal pain, lower abdominal pain. Pain is worse when sprinting, kicking, or changing direction. Tenderness over the pubic ramus, which is a part of your pelvis that is found just laterally or outside relative to the middle of your pelvis, and that's also where the rectus abdominis muscle attaches to. Pain with resisted hip adduction at 0, 45, and 90 degrees of hip bend. So if I'm looking to diagnose a sports hernia, I'm asking my patients to push into my hand as I'm trying to push their leg outwards. They're trying to push into my hand so I can fire some of those growing muscles, and I'm looking to see if that reproduces symptoms at neutral, 45 degrees, and 90 degrees of hip flexion. And the 5th one is pain with a resisted sit-up. So I would get an individual to get into a sit-up position and I would push down and they have to resist me, and that usually reproduces some of that lower abdominal pain. Sports hernias are generally associated with FAI, which is femoral acetabular impingement. So this is impingement in your hip joint that can be from two different pathologies, from a cam or a pincer pathology, where differences in the characteristics or the bony makeup of your femoral head or the ball of your thigh bone and your acetabulum, which is the socket of your pelvis, differences in just how they make contact with each other with movement can be associated with athletic pubalgia. So people who have FAI may have a higher prevalence or ability to get a sports hernia. Okay, Alex, that's all dandy and all, but what do we actually do about it? So physiotherapy and conservative treatment is the mainstay to help an individual who has been diagnosed with a sports hernia. Usually about 3 months of therapy is what's required to help someone get better. If they aren't getting better within that 3-month window, that's generally when surgery is recommended. And individuals who undergo surgery have a good probability of getting better as well, so they have good surgical outcomes. And what does the treatment consist of with physiotherapy? A lot of trunk strengthening, a lot of adductor muscle strengthening, so Copenhagen planks, glute strengthening, planks, regular planks, single leg movements, and then as you start to build that foundation where they can tolerate different positions that increase the pressure around your abdominal area and help to try to provide more strength in your trunk muscles with these exercises, then that's when we would progress to more sport specific movements just based on the goals of the individual and what they can and can't tolerate. So we get to low level plyometrics, double leg to single leg, cutting, pivoting, sprinting, practices, non-contact, contact, and then we get into game-like scenarios. So generally about 3 months of therapy is what would normally be required to help get better. But it varies based on the individual and all the other health history and conditions that they may or may not have. Well, I hope you learned a thing or two about sports hernias, aka athletic pubalgia. I always remember seeing it when I was a kid when athletes would be diagnosed with this, and I never understood or never took the time to realize what that actually entailed. So I've worked with quite a bit of individuals with sports hernias in the past, and they generally do respond to physiotherapy quite well. An exercise program that's tailored to what they can and can't tolerate with progressions and regressions as needed. So we talked about symptoms, we talked about how it happens, we talked about who's affected, we talked about what can be done with individuals with sports hernias, as well as surgery as being another option if conservative care fails. Hopefully you found this information valuable and informative. Please share with somebody who may benefit from learning something like this. It was a pleasure to be able to share this information with you that I've learned based on reading various research studies. And if you could help by liking this page and subscribing to my channel, that would be super appreciative. Until next time, thanks guys.